Before we start, please forgive any mispronunciations of words and possible spelling errors. The anatomy of the endocrine system is fairly simple. The system is made up of glands that make chemicals called hormones that travel in the bloodstream to specific tissue to send it an order out to do something. Each gland of the endocrine system has a different function and secretes different hormones which target specific tissue. The glands and parts of the endocrine system are the hypothalamus, the pituitary glands, the parathyroid glands, the thyroid gland, adrenal glands, pancreas, ovaries for females, and testes for males. The hormones secreted by these glands travel throughout the bloodstream through all parts of the body, though it only has an effect on the target tissue because that tissue has specific receptors for that particular hormone. The endocrine system is important because it helps the body maintain homeostasis by having each part of the body communicating with one another to maintain balance. The endocrine system's primary form of communication is the secretion of hormones. The pineal gland is a gland in the endocrine system that is responsible for secreting the hormone melatonin. The hormone melatonin is responsible for sleep and wake cycles and helps regulate daily biological rhythms. This gland reaches its maximum size between ages 1 through 5. Here are some pictures of the pineal gland. The next set of glands are the hypothalamus and the pituitary glands. These glands are closely linked together because their functions are closely linked. The pituitary gland has two parts, the anterior and posterior pituitary. Their jobs vary depending on the hypothalamus. The hypothalamus serves as a gateway for the brain to control the endocrine system. The infundibulum connects the pituitary glands and the hypothalamus together. The infundibulum serves as a passageway for the two. The hypothalamus secretes several different hormones that target the anterior pituitary, and dependent on what hormone the anterior pituitary received is what hormone it would secrete to send a message to a particular part of the body. These hormones pass through the infundibulum. For example, if the hypothalamus secreted the corticotropin releasing hormone to the anterior pituitary, then the anterior pituitary would know to release the adrenocorticotropic hormone to target the adrenal cortex. I'll have a chart displaying a good bit of them after this slide. These are the most important parts of the endocrine system because they make every other part of the endocrine system work. Here's some of the chemical reactions that go on. The hypothalamus secreting these hormones to the anterior pituitary, which would tell these glands and organs to secrete these hormones. Here's some pictures of the hypothalamus. Here's some pictures of the anterior and posterior pituitary glands. Here's a picture of the infundibulum, which connects the hypothalamus and anterior and posterior pituitary. When the hypothalamus secretes, it passes through here. The thyroid gland is responsible for secreting the T3 and T4 chemicals, which together make the thyroid hormone. These chemicals help regulate metabolism in an individual's body. Calcitonin is also produced in the thyroid gland and helps stimulate the deposition of calcium in the bones. The parathyroid gland is the next gland. Their function is to stimulate both the reabsorption of calcium from the bone and the absorption of calcium in the small intestines and prevent the loss of calcium in urine. Here are some pictures of the thyroid gland, parathyroid glands, and the thyroid gland, I guess, is right here. The pancreas only produces about 2% of the hormones in the endocrine system. The endocrine cells are grouped to 1 to 2 million pancreatic islets. The two hormones produced by the islets are insulin and glucagon, and are important for the regulation of blood glucose levels. Here's a picture of the pancreas. The next gland is the adrenal glands, located near the kidneys. They're the near kidney glands, translates to. It is often stimulated in situations of fear, pain, and stress. In times of stress, the cells from the adrenal medulla can stimulate the cells of the adrenal cortex to secrete the hormone cortisol. And it also secretes 24 other hormones, but I'm not going to name them all. The gonads are ovaries in a female and testes in a male. Ovaries start producing hormones at puberty and continue doing so until menopause. The hormone produced primarily is estrogen, which is responsible for the secondary sex characteristics we see in females. The testes produce the hormone testosterone in males, which lies dormant between birth and puberty and is responsible for secondary sex characteristics in males. Here are some pictures of the ovaries. I chose the disease type 2 diabetes because it's very common in the United States and we all know someone that has it, and with poor diet we're all susceptible to getting this disease. Type 2 diabetes is in fact an endocrine disease because insulin, which is a very important hormone in our pancreas, produces to regulate glucose levels in our blood. If you want to be more specific, it is produced by the beta cells in the islets of the Langerhans in the pancreas. An individual with diabetes loses the ability to use and produce insulin. After your body breaks down sugar and starch from food, insulin delivers glucose to the cells to absorb it and use it for energy. Insulin also helps to eliminate extra glucose from your blood. Symptoms of diabetes can include increased thirst, increased hunger, increased urination, fatigue, and blurred vision. Increased thirst and hunger comes from our body's lack of absorbing glucose, and we have that hungry sensation because we're not getting enough energy from our foods because our lack of absorption. Increased urination goes hand in hand with increased thirst, fatigue because we have lack of energy, and blurred vision because blood doesn't reach a diabetic's eyes and feet and extremities very easily. Some cases, symptoms will not be present at all. Individuals may also experience frequent weight gain or weight loss. Treatment starts with you. Exercising, quitting smoking if the patient smokes, losing weight, and proper nutrition are all ways an individual can prevent developing it, or as a way of treatment if they already have it. An individual with type 2 diabetes can take any but not all of these medications if the signs of low glucose levels appear, or high glucose levels appear. High glucose levels is accurate. Anti-diabetic medication, statin, insulin are all ways of treatment along with diet and exercise. Diabetes is a lifelong disease that can be very grave at times but can be controlled with a proper diet, exercise, and medications.